So I will open the 3 minute. You are ready, doctor?
1 second, 1 second,
Yeah,
1 second.
take your time.
Okay, yeah, I'm ready.
Okay. So I will open the 3 minutes. When you want me to scroll down, just let me know. Okay.
Okay.
That's the 3 minutes.
Yeah, okay, that's fine. 50. Yeah, just stay here. Yeah, please, thank you. Mm-hmm. Okay, if you go down 1 month ago, functional bone, scenic disease, bad absorption. Hmm. Okay, can you go down? Okay, stay here, please, please, please. Go up a bit. Yeah, if you stay here. Sorry, so the consultation above this was 4 months ago.
Was 2 weeks ago, is it? It's 2 weeks. Here,
Okay, okay.
she
So
had 3 to 4 months of fatigue, but she didn't
okay, okay.
present except,
So 2 weeks ago she was
yeah.
examined and everything and had blood tests. So okay, so if you go down, yeah. So what's in the blood test?
Uh,
Um,
it's coming, it's coming. So he ordered the blood test, then she's going to the next doctor.
Dr. Salim. Okay. Now, okay, stay here. Presented with fatigue, stones. Okay.
Okay.
Mm-hmm.
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 Okay. And then this is your test that you will discuss with the patient.
Does some does somebody else want to take this? I can't even read the whole thing.
No, that's fine. I will give you more time. It's okay. Relax.
Okay. EMA is okay. If we just keep it on the test during the consultation, that'd be
Here, you want this test?
yeah, just a bit. Yeah, yeah, yeah.
I
So
can,
ultrasound is done. If we go a bit
yeah,
up,
the ultrasound is there.
so
Okay.
ultrasound, nothing, isn't
And
it?
these are the tests. Yeah, ultrasound is nothing. Yeah.
Hmm. Right. So,
Happy with it? Not yet?
I mean, I guess I'm happy. Yeah.
Okay, so let me just double check the recording is going on. And yeah, don't worry, you will do fine. It's not uncommon to find case like that, which is a real case that I had it last week. Okay, so there is a lot of learning points. Okay, so do you want me to keep here the the screen to be on that, or you want me to go up where the patient name is?
Patient name. I've got the patient name.
Okay, that's good. Okay, So shall we start?
Yes.
Okay.
Mm. Hello, hi, this is Dr. Mir from the surgery. Am I speaking to Catherine Briggs?
Oh yeah, doctor. Thank you for calling.
Hi, what would you like me to call you?
Yeah, Catherine is fine.
Okay, hi, Catherine. Catherine, I understand that you're here to discuss the blood results.
Oh yeah, doctor. To be honest, yeah, because it's becoming nuisance. What's happening to me? I'm very tired. I'm exhausted, and my skin is dry. I'm not sure what's going on with me. And this Dr. Salem, he didn't even explain to me. He said, okay, we'll do more blood test, and he told me my liver function is little bit playing up, and he didn't explain anything to me. He said, oh, more blood test, ultrasound, and I'm not understanding anything.
Oh dear, I'm sorry to hear that you felt that way. We'll be discussing your blood results today. Um, Also, did you have a chance to look at the blood results?
Well, I have a look. I find a lot of high and a lot of positive, and I'm not sure. I say, well, there is something. I hope it's not nothing serious,
Mhm.
because when he told me, the last time when he spoke with me, he told me he think that I have liver cirrhosis or something like that. And actually, doctor, I become terrified when he told me like that. My husband just died from 2 months ago with the liver cirrhosis. So as I'm going to die.
I'm sorry to hear that. You feel that that's been quite a lot for you. So definitely we'll discuss the diagnosis. We'll discuss what's going on in the labs. But is it okay before that? I can ask you a few questions.
Sure, doctor. Yeah, please.
From what I understand from the note that you were having some weight loss, you were losing weight and your skin was getting dry. Can you tell me a bit more about, because I'm meeting you for the first time, why the tests were done?
Oh no, not actually weight loss. I didn't lose massive weight. I just noticed that sometimes my eyes becoming a little bit yellow, and I know
Mm,
that from my husband because at the end, before he died, he had some cancer in the after the cirrhosis because he was alcoholic, so he had cirrhosis, and then they discovered that he have HCC. It's type of cancer they told me, and then I noticed these things are happening to me as well. So his eye becoming was yellow, and sometimes I'm seeing my eye yellow, sometimes not. But then what I noticed that I'm scratching a lot, and then also I feel tired, and that's the worst thing because my work is affected by me feeling that tired.
mm. That just sounds that it's affecting you a lot.
Mm.
And coming to so we'll discuss the work. Coming to your symptoms, you mentioned that your eyes are getting yellow. How does your skin feel? Does it feel yellow as well?
Sometimes, not always, not constantly yellow. I don't know why, why sometimes it's becoming yellow, sometimes not.
And
But yeah, yeah,
go ahead, go ahead. And in terms of your stool, have they changed color?
no, not really.
And what about your waterworks? Have that been okay?
Yeah, yeah, I'm peeing fine. I'm peeing for
Mhm.
England, to be honest, because I like to drink a lot of water, so I don't think there is any problem with my wee.
Okay. And also, what about your tummy? Any tummy pain?
Uh, Sometimes I will have some little bit of a stitchy, type of pain in maybe in my upper part of the tummy, but not significant.
Mm-hmm. And do you feel that, your tummy feels bloated in any way or just.
Sometimes, yeah, doctor. The issue is the diarrhea. I'm getting a lot of diarrhea, doctor.
You're getting a lot of diarrhea. How
Yeah,
many
yeah.
episodes are you getting in a day?
Well, sometimes I'm getting three, five, maybe five time or six time, and it's severely, and greasy, hard to flush.
Mhm. Right. And also in terms of have you felt any lumps or bumps anywhere?
No.
Okay. And feeling tired, I understand. What about your appetite? Has that been okay?
Yeah, well, sometimes I will feel nauseated. Since my husband died, all my appetite is not massively great because
Mm,
and that's why the first doctor, he was a locum doctor, but he's much better than that Dr. Salim. He was very kind, and he told me probably are in a grief period, and that's put me in a relief little bit that I might be
mm,
grieving. But Dr. Salim, he told me this my liver and cirrhosis, he make me scared.
So you okay, and also looking at this, do you think that it was okay? Are you worried about anything besides the liver problem and cirrhosis?
Well, no, to be honest, just if if it's, I'm not sure if it's cirrhosis, then I'm going to die like my husband. I know we have a daughter. I need to prepare the things for her. You know, yeah, she's no, she's a mom now, and but she's still she still need me around.
Of course, yes. And have you had any thoughts how you think we can best help you?
Just calm me down, doctor. I don't know. I need this fatigue to go away because I need also to return to my work.
Okay. And when you mentioned work, what do you do?
Oh, doctor, I'm working in Tesco, on the shop floor, carrying
Okay.
things, putting things. Yeah, so it's very physical. So, yeah.
Are you currently off work?
Well, yeah, doctor, every now and then I'm taking sick, no, I'm taking sick leave. I'm informing them I'm tired, but, my boss has started, to, yeah, he started to show that he's not happy with that. And I understand from where he's coming, but the issue really, I can't, I'm feeling tired.
Yeah, yeah, I understand. And with everything going on, you've had these symptoms. I understand your husband's passed away recently. How's your mood been?
Well, it's not great, as I told you. My mood
Mm.
is not excellent.
Mm. And would you say with low mood, sometimes people tend to have dark thoughts, like thoughts about self-harm
No,
or
no, doctor.
suicide?
No, doctor. I need to stay here for my daughter.
Hmm. Does she live with you?
No, no. She have her boyfriend. They're living together. So, but it's still she needs some guidance in her life. She's in her 20s, so still she's young.
Mm. Okay, okay. You sound like a very caring mom, which is excellent. And just a few lifestyle things because they affect our health, and especially with liver related problems. Do you smoke?
Oh no, doctor. I never smoke.
What about alcohol?
Never alcohol. I don't like it.
Okay. And have you ever had any problems, have any kind of tattoos,
No, no.
blood transfusions?
No, not I'm aware of that. No.
Okay, all right. Thank you, Catherine, for sharing all that information. I understand you wanted to know about the blood results. And with what you're worried about having, cirrhosis, and I understand, you've had your husband's had that and you've had a bad, experience with that. It's totally understandable. Looking at your blood results, yes, you're right. Your liver function, your liver does not seem to be doing very well,
Hmm.
and your tests do not look okay there. But looking at the rest of the profile, it looks like you have an autoimmune disease of the liver. Have you heard about this before?
Autoimmune.
Mm.
No, what does it mean, doctor?
So it means that our immune system, which is supposed to protect our body,
Hmm.
it's now working against you.
Oh,
So the immune cells which are protecting the body are actually attacking the liver.
attacking. Oh my God.
Yeah. I'm sorry, it sounds like a dramatic word, but it's like working against you. So hence you're feeling really tired, and you're getting the symptoms that you are. And because of your liver being affected, that's why you're getting the itching as well and your yellow coloration of the eyes.
Okay.
I know you asked me about cirrhosis. Now, if you come down to the liver, to the ultrasound report a bit, and I'll just show it to you. So, with cirrhosis of liver, you've had the ultrasound scan, and it does not look like a picture of cirrhosis of liver.
Okay, that's reassuring little bit. So it's not a cancer as well, doctor?
With things that you've told me, you've not felt any lumps or bumps anywhere. You've not had any loss of weight. Your appetite's not been great, but we can explain that with other things. And it doesn't have a picture of cirrhosis of liver.
Okay, okay, that's reassuring at least. How you are putting me in ease, not like this, doctor. So what? So what we should do then, doctor?
So, but I will also say that sometimes, very initially, your your ultrasound scan can be normal. So, for you, what I want to do is actually send your details to the liver doctor. So you've had
Okay.
the ultrasound scan, you've had the blood test done, you've had a profile, and like I mentioned, the autoimmune screen as well. So I will be sending these details over to the liver doctor,
Hmm.
and I will refer you to them urgently.
Hmm.
Would that be okay?
Oh yeah, sure, doctor. Do
I,
what he will do for me, do you think?
they might do another CT MRI scan, so and more imaging of your liver. And if they think they might offer you more medication. To be honest, I don't know what else they might plan to do, but they
Hmm.
might do more imaging for you.
Hmm.
The Would that be okay? Are you with me so far, Catherine?
Yeah, yeah, yeah.
um yeah, the other thing, Catherine, is I am not I've had a look. Has Mr. Dr. Salim been able to examine you? He
I
did.
think no, the first doctor, the locum one.
So
This
he's
Dr.
just.
Salim, he didn't even stand up from that chair. He was
Oh
lazy.
dear. Well, he's got a very good reputation, but I'm sorry you felt that way.
Yeah.
The first doctor who saw you and he examined you, since that day, are your symptoms better, worse, or are they the same?
No, doctor, it's the same to be honest. It's not
Okay.
worse. No.
Right. So I will be sending your referral over to the specialist. In the meanwhile, if you feel that you feel any lumps or bumps anywhere, your yellow discoloration gets worse, your symptoms basically get worse, or you feel that your tummy is increasing in size, just to come back to us sooner or get urgent medical help. Like, you can also go to A&E anytime. I will follow you up again in 2 weeks' time. Would that be
Hmm.
okay? Would that be something reassuring for you?
Yeah, sure, doctor. So can I still take my medication or there's any problem with it?
If you scroll up to the medication, can you go back to the medication, please?
Hmm.
Oh, okay. Hmm. Well, I guess you can.
Okay, thank you, doctor. Yeah, thank you.
So I have no idea
Mm.
what this is.
Yeah, it's a difficult case, but it's a learning case. Okay,
Okay.
so yeah, that's why we are putting it, so we can learn from it. Okay, it's a case that, and we are saying level up. We are living up the knowledge. Okay, so I know that a lot of us are just ordering the test, and actually, you know, the interpretation. To order the something is fine. Everyone can order the things, but then after ordering that, what you will do with it is the most important. Okay,
Yes.
you don't accept that if you order all the liver autoimmune and it will come to you, and then, okay, you need to interpret it. Wow, yeah,
Mm-hmm.
you need to know how to interpret it. Is that something I need to worry about, or is that something I don't need to worry about? Yeah, so did you guess what might be the case?
It's
Because
biliary.
first we will discuss the case in general, and then we will close the recording, and then we'll give you a specific feedback. But did you have a guess what might be the case?
Um,
Yeah, it's autoimmune.
Primary
That
biliary, yeah.
at
So it's autoimmune. So is it
uh-huh,
primary
uh-huh.
biliary cirrhosis then?
Okay, so why you didn't say? Why you didn't say? You know it.
Okay.
Why you didn't say?
I don't know, because I think I didn't
What?
expect.
What? Why?
Yeah, I don't know.
Why?
I got.
You can diagnose it in the primary care.
I think I was thinking about primary biliary cirrhosis and primary sclerosing cholangitis. I don't
Yeah,
know.
no, sclerosing cholangitis, it will be different. Yeah, we will have a table showing the difference. Okay, so the other one is more in the males. Okay, more in the younger age, more with
Oh,
ulcerative
yeah.
colitis and Crohn's, isn't it? So patient
Mm-hmm.
doesn't have ulcerative colitis, doesn't have Crohn's. Okay, and she's
Yes.
female, so that's going
Mm-hmm.
toward the primary
Primary biliary
cholangitis.
cirrhosis.
Yeah,
Yeah.
that's
Okay. Okay.
right.
I didn't
So
remember
yeah.
that, so I just said
Yeah, yeah.
autoimmune. I know. I
Which
didn't
which
connect.
and also the other one will have, the beading sign in the ultrasound. They will be, and it's affecting intrahepatic and extrahepatic biliary tree. So there will be other signs and symptoms in the ultrasounds. Okay, so we will not see. It's very difficult that you will find it all. It's normal ultrasound. So since it's symptomatic, the primary sclerosing cholangitis, since it's symptomatic, then you will find something in the ultrasound. But the primary, primary biliary cirrhosis, okay, or primary biliary cholangitis, usually, even if it's symptomatic, because it's stasis, isn't it? So it will be very early showing the stasis before the cirrhosis happen by several years. Okay, so that's one of the main differential, and the other one also the primary sclerosing cholangitis
Mm.
will come with cholangitis, true cholangitis. The patient will always have fever, infection in the biliary tree, biliary sepsis. So that's a serious things, okay? And always associated with, ulcerative colitis and Crohn's. The other one always associated with other autoimmune disease, which you need then to cover. So here they make thyroid, they make hemoglobin A1C, but you didn't ask about, okay, what about skin? Do you have any skin issues, rash, eye problem? Okay, and try to screen for any autoimmune disease associated with.
Okay.
That's probably the main two difference. So there
Mm.
is difference in the sex and difference also in the association. Uh, Probably because there is and actually both of them is one of the symptoms of tired all the time. Patient will present with tiredness. Okay, uh, she would tell, I'm tired, okay, and then when they did for her the liver function, the normal liver tired all the time blood test, they find little bit the stasis marker is high. That's the learning point that I want everyone to take
Which
care of
marker?
it. Stasis
Actually,
marker. So if you see the alkaline phosphatase is high, and we said the alkaline phosphatase can be from the liver or extra liver things, okay, like thyroid, placenta, bone, okay, and how to know if that is coming from the liver or not by doing the GGT. Okay, if the GGT is high, then that's most probably the alkaline phosphatase is coming from the liver. If the GGT is normal, then means that the alkaline phosphatase is probably coming from extra liver resources or sources. The ALT also is high, and the globulin, that's important. Here, this point, globulin high. What does it mean, globulin high? If you have high globulin, what does it mean? Although it's very mildly elevated, by the way. So the upper limit here until 35. So 37, what does it mean, globulin high? So what is the function of the globulin? Hmm.
Globulin is
Immunoglobulin. Immunoglobulin,
Yeah,
guys.
points towards
yeah,
autoimmune thing.
Yeah,
globulin
globulin. Yeah.
or
Yeah, globulin
hemoglobin.
or hemoglobin. Yeah, globulin mainly is immunoglobulin. Mainly there is something in the immunity. Mainly, okay. So when you find the globulin high, don't ignore that. Please chase it, okay. Follow it up, even if it's mildly elevated. Is that patient have multiple myeloma and that's early presentation of it, okay, or there is something in his immune system? Okay, don't ignore it. Yes, this subtle changes can denote something, especially the patient is complaining. If the patient is asymptomatic, I would say, okay, just ignore it. Okay, but patient coming to you to, I have a problem. There is issue with me, doctor. I'm not normal. Okay, so then no, please don't just, oh, it's a slight change. No, that's can lead to something else. So, and that's why the doctor, when he said, okay, I will repeat, as we said, when you have liver function is high and patient doesn't have any emergency, okay, for sure high, not more than 5 times of the normal, because 5 times, 10 times of the normal, that's an emergency. The patient need to be assessed urgently in the hospital. But if it's, elevated 2 or 3 times of the normal, then look at the medication. If there's any medication issue, can be the cause of that, try to stop them, and then repeat the blood test and including the liver screening. Okay, liver ultrasound, autoimmune screening, hepatitis B, hepatitis C, and ask about, the risk, high risk behavior, like Sana asked. Okay, do you have any tattoo, IV drug, injection, unprotected sexual intercourse, recent travel, okay, blood transfusion? All these are, high risk behavior. So then the doctor asked for that, and then now it's your turn. Okay, when the result came and you need to, to explain what is happening. Okay, so we said the alkaline phosphatase high, GGT high, little bit ALT is high, little bit is high. Probably we need here also AST, but it was not done. However, from here we can confirm that there is a stasis. So these are marker of a stasis. High alkaline phosphatase, high GGT, then means that there is a stasis in the liver. So there is a problem in the biliary tree. There's a problem in the sewage of the liver, okay, because that's the things that are going out of the liver. So any problem in the liver biliary tree can be either obstructive or non-obstructive, okay, functional, okay, obstructive or visible obstruction, or functional in the beginning, or even micro obstruction. So how you will know how to differentiate? You will ask for ultrasound. The ultrasound is saying, okay, liver anatomy is normal, biliary tree is normal, there is no obstruction, there is no stone in the gallstone in the gallbladder, there is no stone in the common bile duct, okay, there is no dilatation in the common bile duct, because if there is dilatation in the common bile duct, the second step will be referred for ARCP or MRCP, okay, but here there is nothing, okay, so the biliary tree is clear, okay, but there is another markers that denoting you that there is something else that is happening, is the autoimmune markers, okay. So we can see here the AMA, okay, the anti-mitochondrial antibody, okay, is weak positive, okay, and then the ANA, which is strongly positive. So these two markers are markers of autoimmune disease, which is called the primary biliary cholangitis or primary biliary cirrhosis. So the answer is in this small bits, and that's why please, when you are doing cases, read the case until the end. Read the case until the end. Okay, for me, if I'm doing this case, the first thing I will do, okay, this patient is coming. Why is coming? Coming for scan and result. I will scroll down. Where is the scan and the result? Where is the scan? So he's coming for these. I will read that, try to figure it out, and then I will start to read what is going on. Okay, I will read here, I will scan it, okay, rapidly, because most of these, what happened here mostly is not of clinically significance, to be honest. Yeah, that he find it normal, okay, or even I can scroll it, okay, while I'm talking with the patient, okay. But the main thing, he's coming for what? Coming for blood results. So where is the blood result and the scan? Is there? Let me have a look. Okay, so let me see why he came also. He came for tiredness. He saw someone who ordered the blood. Okay, he saw that doctor, he ordered further blood. So is these bloods become worse than that? Yeah, there is a slight increase. So then there is something going on. And then with the autoantibodies is there. So I can reach the diagnosis. You don't need for any further investigation. You don't need any biopsy. That's a diagnosis of primary biliary cirrhosis, okay, or primary biliary cholangitis. Here, hepatitis A, because that was a red herring. Hepatitis A, IgA, G, IgG positive. We said G mean long. Okay, so that's mean that the patient have past infection, and the IgM is negative. Okay, mean that there is no acute infection. That was just a red herring to mislead you. Okay, is that clear?
Yes.
So then the next step, what we are doing for primary biliary cirrhosis. So basically, you tell yes, it's an autoimmune disease. I don't like the way that you are explaining the autoimmune disease, and when we do the specific feedback, I will tell you how to do it. Okay. The other thing is what our rule is. Yeah, you will refer to the hepatology doctor, yes, but you have also some rules. So basically, the treatment of primary biliary cirrhosis, yeah, okay, that there is no cirrhosis, we can delay it, okay, we can try to control it. There is no specific cure because it's long lasting. We are searching for the other associated autoimmune disease, then we can control the autoimmune diseases, and hence we can control the primary biliary cholangitis. Okay, cirrhosis is a misname, okay, misname, okay, because it's not cirrhosis. Yeah, it can lead to cirrhosis, but in the beginning it's just inflammation from the autoimmune activity and the autoantibodies. uh, Basically, you need to decrease the stasis, ursodeoxycholic acid tablet, okay, as she can tolerate. And then the problem is that the absorption of fat and fat soluble vitamin will be decreased. So vitamin D will be decreased, calcium will be decreased. Then so osteoporosis is here highly likely. So they need a baseline DEXA scan, and they need calcium and vitamin D supplementation. Okay, and then general health advice. Okay, avoid alcohol, decrease alcohol, and then see what you can do regarding hair medication. The trick here regarding the primary biliary cirrhosis is the Everol Conti patch. Okay, yes, Everol Conti patch. We said when there is highly, that the HRT is contraindicated when the liver function is high, isn't it?
Yes.
Yes, when there is liver derangement. But and if overall Conti and the liver function will be stable, you will follow it up and it's stable, then there is no need to stop the overall Conti because it's transdermal, so it's bypassing the liver. Okay, the first pass metabolism is already bypassed. Okay, so that should not affect the liver. However, you might consider stopping it transiently until you reach the definite diagnosis from the hepatology and then continue it. Yeah, that's fine. Or you can tell her that we can continue on it until we see how is the liver function and see if it will increase or not. Okay, because the synthetic function of the liver here is not markedly affected. Yes, you can see the bilirubin is normal, the albumin is normal. So there is no massive injury to the liver cell itself. The problem on in the stasis. Okay, if it's an oral HRT, that will be a different story. I would be guided by the hepatology, okay, before continuing the tablet form, okay, because the high percentage of estrogen and progesterone in comparison to the transdermal one. Yeah. So as we said, primary biliary cirrhosis autoantibodies. Okay. The stasis marker will be high. Okay. CRB might be high, and then the most important, the AMA, anti-mitochondrial antibody, and ANA will be high. Okay. The AMA is positive in more than 95% of the patient that have the disease. All what we need to diagnose is 2 out of 3 biochemical evidence of stasis. Okay, and then one of the antibodies to be positive, and then if only one of these, then we will go for the biopsy and histopathology. Okay, but if these two are positive, which you can diagnose it in the primary care, then you reach the diagnosis. Okay, refer to hepatology, ursodeoxycholic acid, and then repeat the liver function every 3 to 6 months, and then don't forget the DEXA scan and vitamin D, and then searching for the associated diseases. Okay, associated autoimmune disease, and then you can also advise to see if there is any anemia, any thyroid dysfunction. Okay, which you already did. Okay, and then the vaccination, promote vaccination. Okay, because that's an autoimmune disease, to promote vaccination, like as we said, the flu vaccine, influenza vaccine, pneumococcal vaccine, and hepatitis vaccines. Okay, and then the follow-up after diagnosis, because even if the primary care, secondary care reach the diagnosis, then the follow-up will be, liver function, and every 3 to 6 months to see how the liver function is, and then annually vitamin D, and the annual check in general, and then the DEXA scan every 3 years, and then for sure medication reconciliation every 12 months as usual. What are the autoimmune diseases that can present with it? Thyroid, mainly thyroid, mainly diabetes, and then celiac disease, rheumatoid arthritis, Sjogren's syndrome. There is a rare association that they can, if the patient is, unlucky, okay, to have primary biliary cirrhosis and primary sclerosing cholangitis. Very rare, both of them to present in the same patient, but it can. Okay. So that's mainly what I want to say for the primary biliary cirrhosis. I just want to show you the table, showing the different the cancer risk can happen only when the patient start to have cirrhosis. So at the end, in the spectrum of the disease, when the cirrhosis happen, then cirrhosis equal probable hepatocellular carcinoma, like her husband. Okay, so her husband died of hepatocellular carcinoma secondary to cirrhosis. So once cirrhosis is there, usually you are doing 6 monthly liver function and ultrasound with alpha fetoprotein. Okay, that's for you just to know. Okay, cholangiocarcinoma also very rare. Cholangiocarcinoma usually will be secondary to primary sclerosing cholangitis, not primary biliary cirrhosis, but there is some reports that sometimes can happen. So, that's why we are following the liver function. If there is any dramatic a change in the liver function, then that's you need to alarm you. Okay, what are the difference between primary biliary cirrhosis and then primary sclerosing cholangitis? So one is autoimmune disease, okay, affecting the intrahepatic biliary duct, okay, but the sclerosing cholangitis affecting intra and extra, okay. The sclerosing cholangitis affecting men, middle age, the primary cholangitis affecting women's, okay. Usually that associated the primary cholangitis with autoimmune disease, the others associated with inflammatory bowel disease. Okay, that's the main things that I want to know about it, because then the symptoms more or less the same. Other than that, the sclerosing one will come with frequent biliary sepsis, and then the lab, as we said, alkaline phosphatase, GGT high, and AMA. Here it will be ANCA, okay, ANCA positive, but AMA will be negative. Okay, ANCA positive, that will take you towards the sclerosing cholangitis, and then once there is a sclerosing, okay, then ARCP or MRCP. When there is dilatation of the biliary tree, whenever there is dilatation in the biliary tree, even if you cannot see any obstruction, need to refer the patient for MRCP or ARCP. MRCP you can order it, it's MR, okay, MRI, okay, MRCP you can order it as a GP. ARCP then you need to refer to the hepatology, then because ARCP is endoscopy, okay, endoscopic retrograde, okay, camera for the biliary tree. Okay, is that clear? Do anyone have question or it's difficult?
Yeah, primary, Dr. Islam, we
Yeah.
are not going to do ERCP or MRCP for primary biliary cholangitis.
No,
That's
no,
for the
no.
sclerosing cholangitis,
That's
right?
the first sclerosing, yeah.
Okay.
Okay, because primary
Yeah.
biliary cholangitis usually there, if you have the lab test as we show, then that's diagnostic. You don't need to do anything more. Okay, so ultrasound is
Okay.
clear, and then the autoantibody is positive, and the stasis marker is positive. Then there is no need to do anything more than that, and you don't need biopsy. And for sure guided by hepatology, okay, but usually they will not do any further investigation for such patients. Okay,
Okay.
is that clear? It's fine. Shall we? I will close the recording.